you in City Hall. I want to make one correction as we begin. The text to give number, again, just for those who didn't get it, is 243-725. Again, that's 243-725. We also like to thank Mayor Burke for his commitment to not only our city, but to NCBW and the work we're doing in our community as he leads the city during these unprecedented times with the historic COVID-19 pandemic. That being said, ladies and gentlemen, you are all in for a real treat this evening because we have a panel of powerhouses. These bold, audacious, and fearless Black women are leaders in their field, and they are bringing a wealth of information and knowledge and experience to the table. Get ready to collect several wisdom nuggets as we delve into the areas of health, social engagement, business, legal policy, and advocacy. I assure you that at the end of this discussion, you will leave even more educated and empowered. I am humbled to have the opportunity to moderate this discussion with these extraordinary women. Our panelists for this evening are Dr. LaTanya Washington, Tennessee Senator Ramesh Akbari, Judge Ashley Parker Dunstan, Reverend Dr. Cecilia Greenbar, Miss Michelle Morris, Miss Tanya McCleary, Dr. Mary Lambert, and last but not least, Ms. Kimberly Ellis. You will hear from each panelist soon, but now without further ado, allow me to introduce our first panelist for the evening. Dr. LaTanya B. Washington is the president of the Bluff City Medical Society, the premier organization for physicians of color for Memphis, a metropolitan area, and a subsidiary of the National Medical Association. Dr. Washington is a board certified doctor in internal medicine and pediatrics, and is currently the physician advisor at St. Francis Hospital, Memphis. She maintains an active clinical hospital privileges at St. Francis Hospital and Methodist Le Bonheur Healthcare. She received a Bachelor's of Science from Tougaloo College and a Doctor of Medicine at the University of Tennessee Health Science in Memphis. She completed a combined internal medicine and pediatric residency at the University of Arkansas for Medical Sciences and obtained a Master's of Business Administration at Auburn University. Dr. Washington is a passionate doctor, and she's passionate about bringing awareness to social injustices, identifying and improving health inequalities through improving health literacy and health care access, and the need to increase diversity in healthcare by increasing the number of underrepresented minorities in medicine. So right now, I would like to thank Dr. Washington for joining us today. How are you doing, Dr. Washington?
Hi, good evening.
Good evening, good to see you. Dr. Washington, I'm gonna begin with you. Lack of federal leadership in America's COVID-19 responses has led to a great deal of unnecessary death, and Black America is bearing the burden. Our death rate is more than twice the rate of white, Asian, and Latina populations. As the federal and some state governments continue to ignore public health experts and the pressure to reopen without caution increases, how will our communities continue to be impacted? And what can we do to stay safe as possible during this time?
Absolutely. Thank you for the question. First, I'd like to take the opportunity to thank the National Coalition of 100 Black Women Chattanooga chapter, as well as the Black Women's Health Imperative and Ebony Magazine for this opportunity and to be in the presence of all of these amazing Black women. So when we talk about COVID-19, it is really a serious threat to Black America, and we have to take it as such. As this country continues to reopen businesses and schools, we'll certainly see increased numbers of COVID-19 cases and deaths. As it stands, as it has been stated previously, Black people are dying at 2.5 times that of white Americans. Also, Black people make up about 13% of the US population, but they account for about 20% of this nation's COVID-19 cases and about 23% of this nation's COVID-19 related deaths. In Tennessee specifically, Blacks make up 17% of the population. However, they account for 25% of the state's COVID-19 cases and about 35% of the state's COVID-19 deaths. This is alarming.
Yeah.
COVID-19 is really affecting every facet of Black America. Our health, our businesses, and our financial stability, as a community are at stake. We really must continue to remain vigilant against this threat to stop the spread. We must adhere to the guidelines of wearing masks, social distancing, avoiding large groups, and washing our hands. As Black women, we are often the navigators of health for our entire families. It's important that we lead by example and that we protect ourselves, because we all know that when the mom is ill, the overall health of the family suffers. As Black women, we often make sure that everyone else is okay. Thus, it's important that as Black women, we are able to acknowledge and understand symptoms, avoid working while we're sick, and avoid being exposed to others who might be sick, because we risk bringing the virus home to the people that we love. When we seek these healthcare services for any reason, it's important that as Black women, we must be able to appropriately relay the presenting symptoms, medical history, and medications to our care team. And it's important that as Black women, we're advocates for our children, our spouses, and our extended families when they seek healthcare. During this pandemic, I will say that it's certainly important to provide a written list of medical conditions, medications, allergies, medical providers, and next of kin with phone numbers for ourselves and each one of our family members. Because during this pandemic, there's restricted visitation in hospitals and healthcare settings. And so it may not allow for us to be physically present with those we love. And then also very important is that we keep these chronic conditions that are at increased risk for COVID-related deaths in check. I'll also take time to say that it's very important that we don't forego any routine preventive care, such as mammograms, pap smears, and colonoscopies. We know that early detection and treatment is key in our outcomes for breast cancer, cervical cancer, and colon cancer, all of which right now Black folks are adversely affected when compared to our white counterparts. And then finally, as Black women, we must protect our children. While the majority of COVID-19 cases and deaths have been attributed to adults, that risk is not zero for children. We must encourage our children to adhere to the same guidelines as adults, with wearing masks, social distancing, and frequent hand washing. Because while children less frequently exhibit symptoms of severe disease, there is potential risk for spread to family members and persons with chronic conditions. In closing, I'm convinced that as Black women, we will continue to be exemplary leaders by protecting ourselves, our families, and our communities to improve our overall health and to stop the spread of COVID-19. Thank you.
Thank you, Dr. Washington. You said something, and I'm gonna ping back to that, that Black women often have to be the navigators of health. How is that just significant in the family structure, in the Black family structure? Why is that so significant?
Yeah, absolutely. There have been so many times in patient care settings when we see Black women come in, they are often accompany their children, they often accompany their spouses, they often accompany their parents, their grandparents. And so they're really that glue that keep the health history intact. They're often the ones who pick up the medications, who make the appointments and things like that. And so we understand the importance of family. And so now during the time of the pandemic, we're seeing that is somewhat broken because the family members aren't able to be there with their loved ones. And so that's something that's very important.
Thank you, Dr. Washington. That's why we need to make sure we're healthy as well. So the next panelist that I have the pleasure of introducing is Senator Ramesh Akbari. Senator Akbari was elected to the, and one in particular, I just want to make sure that I am saying this. Let's see, let me make sure. Okay, I have this question. Please address if GMOs, so genetic modified organism, and any other scientifically modified products in our foods affect Blacks differently than it affects our white counterparts. Is this leading to infertility issues and other health issues that we face? This is from participant Carrie Monks. Please address this. Anybody can take that?
I'll take it with a question.
Okay.
Do we know enough? What kind of research has been done in that area? We don't know. We don't know enough to know what we should know and to be able to answer that question and to be able to make decisions that are in the best interest of our health. I do worry about the lack of research in certain areas, in particular related to how drugs, food additives, genetically modified foods impact African Americans. We've had to fight to make sure that there's a better representation in research related to drugs that are coming on new to the market. One of my assignments was with the Food and Drug Administration. We reviewed new drug applications. That same kind of making sure that the research specifically answers questions about those very kinds of issues. We don't have enough information. We should, and that's a policy issue related to how research is done, particularly research that is funded by tax dollars.
And I wanted Dr. Washington, if you would, I think you answered that in the chat. They were really impressed with what you said. Could you share a little bit?
Yeah, I did take an opportunity to answer that in the chat, and I agree with Dr. Lambert's statements in that there hasn't been a whole lot of research done on genetically modified organisms. And so we have to think about that in the way that our food is being produced, the way that there are various chemicals in products that are available on the market can affect our reproductive health. Again, we don't know, but we're seeing that young women are beginning their menstrual cycles much earlier. We've seen that there have also, young women are having more issues with fertility. We also have to think about other things that adversely affect the African American community, such as obesity, diabetes, uterine fibroids, polycystic ovarian syndrome, certain conditions like that affect fertility. And then on top of that, we have the addition of these genetically modified organisms that pretty much, when you break it down, is that they are using hormones to inject into the foods. And so when we consume those hormones in our body, then it has effects on our reproductivity. It has effects on our weight. I often in clinical practice, I have had older patients come in and say, nothing has changed about what I'm doing. My diet hasn't changed. And I ask them about the foods that they're eating. And, they're buying, prepackaged foods or modified foods. And I say, well, you're putting those hormones in your body. And so for the young women, we're seeing that they're coming and they're having, larger breasts and all of those types of things. For the older women, we are fully developed. So what happens is we tend to grow out, meaning we tend to become more round, if you will, and it contributes to obesity. So that's certainly something to think about, but there's just not a lot of research and not a lot of published data to say what's actually happening.
That was a very interesting question. And I like the way you and Dr. Lambert answered that question, because there's already been untrust, a lot of mistrust, if you would, of the medical field and people, and Black people already don't want to go to the doctor. And then, to be able to go and to be honestly treated and cared for. Not only that, the food that we have access for. So thank you so much for answering that. I think there was a question, this is the last one. Dr. Greenbar, you shared a website Was it called ewg.org? Is that what you shared?
Yes.
Is that right? Okay.
Yes.
So that website is ewg.org.
Correct.
Okay, thank you all so much. So I thank you for joining us, and I hope we had time to answer a little bit more questions. I don't see, I think they may be texting me one, but I want to stay on time since I got us behind. So as we approach the end of our discussion, I want to thank you all for coming on and for talking to us today. We are so extremely grateful and honored to have each of you phenomenal women join us today. This has truly been a wonderful time, and it appears that the audience enjoyed it as well because these questions are still coming. So looking at the comments, just a reminder to our audience that this particular webinar has been recorded so that you can share it with others and come back to grab some nuggets you may have missed. So with that being said, I'm going to turn it back over to my chapter president, Deb Flagg. Thank you all so much.
Hello.
Hi, Deb.
Hello, and
Okay, turning it back over to you.
all right, thank you. Thank you. That was phenomenal. Phenomenal, Karen. Thank you so much. Thank you for taking the time today to be in community with us and each other. I am encouraged that the women we heard from today and those tuning in across the country are people with whom we are building this movement. Black women are extraordinary, aren't we? I hope that you will revisit this recording many times as we push forward. One of the things that I'd like to just mention in honor of the memory of Congressman John Lewis, casting our vote is the most powerful nonviolent act we can do to change the world. And that is why I will always proudly cast my vote. Thank you once again to the phenomenal facilitators of this conversation, the National Coalition of 100 Black Women, Chattanooga chapter, Ebony Magazine, and the Black Women's Health Imperative. A very special thank you to our sponsors, Erlanger Hospital, Tennessee Valley Federal Credit Union, AARP, Cigna Healthcare, Sharon and Bill Alexander, Four Seasons Lawn Care, Allstate Insurance, Greater Brainerd Dental, Highview Healthcare Partners, LLC, and all that contributed to our text to give. Can we show our thermometer? If not, NCBW Chattanooga is committed to lifting our voices. Oh, we raised $125. Thank you so much for everyone that made a contribution. We thank you so much, and the money will go towards our scholarship fund. Thank you, thank you. NCBW Chattanooga is committed to lifting our voices and continue to advocate for women and girls of our community. Keep up with us and our future events on social media platforms. This is just the beginning. Thank you. Please stay safe and healthy, and good night.